Breathe in, left leg back, right foot in between two palms, Ashwa Sanchalana. With exhalation, Parvatasana. With inhale and exhale, Ashtanga Namaskar. Knees down, chest down, chin down. Knees together, toes together, raise your hips up, elbows closer to the body. Now stretch your whole body, go to Bhujangasana with inhalation. Open the chest here, shoulder. With exhalation, Parvatasana again. With inhalation, left foot forward. With exhalation, Padahastasana. With inhalation, raise your body and bend back. Then Pranamasana. We'll do 2 more rounds now. Breathe in. Breathing out. Bend forward. Feel the compression towards your reproductive organs. It works on your reproductive organs, digestive organs, and blood flow to the head. With inhalation, Ashwa Sanchalanasana. Look up. Feel the stretch on your spine, pelvic region, pelvic joints. Then stretch in your throat on stimulating thyroid glands. With exhalation, Parvatasana, mountain pose. Stretch in your hands, stretch in your legs, and it also works on the endocrine system. Pituitary gland, pineal gland, hypothalamus gland, blood flow to the head. Ashtanga Namaskar, knees down, chest down, chin down. Stretch your whole body first on the mat, then go to Bhujangasana, raise your body up with inhalation. Open the chest and the lungs here. It works on your lungs, thyroid glands, parallelly on your reproductive organs. Then with exhalation, again Parvatasana. With exhalation, again Parvatasana. With inhalation, Ashwa Sanchalasana. Feel the stretch on the pelvic, hip, knee joints, thigh, hamstring. With exhalation, Padahastasana. Again, stretch on your back of your leg, then the lower extremities, hamstring, quadricep, calf muscles, and the extension of your spine, then the reproductive organs. With inhalation, again, bend back, then Pranamasana. Fourth round. Join the palms again. With inhalation, raise your both hands and then bend back. Keep your knees straight here, arms closer to ears, bend back as much as possible. Feel the expansion of your lungs. Stretch in your throat, spine. Exhaling, bend forward. Slow exhalation. Do not exhale and bend forward. Slow exhalation till you reach to the final position. Stretch on your back of your legs and the reproductive organs. With inhalation, left leg back. Both palms. If palms doesn't reach, you can even cup the fingers also. Keep your palm in cupped fingers. Look up, stretch, open up your chest here. Open, stretch your spine. With exhalation, Parvatasana. Feet together if possible, heels together, heels down if possible. If not, raise it up. And then head in between the arms. Do not separate them. Lengthen your spine here. Feel the blood gushing to the brain here. Inhale, exhale. Knees down, chest down, chin down, elbows closer to the body. Then stretch the whole body. Go to Bhujangasana with inhalation. Again, your awareness shifting onto the reproductive organs. Exhaling. Parvatasana again. With inhalation, foot forward, Ashwasanchalanasana. With exhalation, Padahastasana. Lengthen the spine, keep your knees straight, bend down as much as you can. With inhalation, raise your body up and bend back. Then Pranamasana. Relax. Close your eyes. Relax. Try to notice the changes when you are in the relaxing position. Changes on your body, on different organs, muscles, joints, and the breathing, changes in the breathing rhythm and the mind, whether you were involved in the practice or not. With slow inhalation and slow exhalation. Now slowly open your eyes. Coming to the sitting position, we will do few asanas in the sitting position. Come to the sitting position like this, which we call Purna Titili, full butterfly pose. Fold your legs. Any kind of spinal issues, L5, L4, you have to skip. Knee issues, you can, if there is any knee issues, you can keep it a distance like this. As you can bring your feet together closer to the body, sit erect. Try to lift your chest up. Don't drop the chest down or round your shoulders. Your shoulders should be broader and lifted up like this. Sit erect. And then hold your feet. Then flap. First we will do butterfly. Purna Titili. Breathe in, breathe out. Breathe in, breathe out. Now your focus should be shifting onto the reproductive organs. That is below the navel is your reproductive organs located. So take your awareness there. Breathe in, breathe out. Breathe in, breathe out. Close your eyes. Focus on your reproductive organs. This works directly on your reproductive organs, on your uterus, improving the blood circulation, toning the reproductive organs, pelvic joints, and also in menstrual cramps. Breathe in, breathe out. Try touching your knees. Bring your knees closer to the mat. Try to open this pelvic joints. Breathe in, breathe out. Breathe in, breathe out. Now we will stay in the same position, Bhadrasana. We'll stay in the same position. Close your eyes there. Keep breathing normally here when you hold the position. Try loosening the pelvic joints and keep dropping your knees down towards the mat. And your focus is on your breathing, focus is on your reproductive organs to improve the blood circulation to your uterus. And your reproductive organs are becoming healthy. With that positive mindset, stay in that position up to 10 seconds. Now breathe in again, breathe out, down. So we'll repeat one more time again. Same practice. Bringing your awareness on your reproductive organs with the positive mindset that Your reproductive organs are becoming healthy, ovaries are becoming healthy, improving the prana shakti to the reproductive organs, the vital force in the reproductive organs. Breathe in, bring the knees together, and then straighten the legs, relax. Next is Paschimottanasana. First, we will sit in Dandasana like this, stretching the legs together, palm beside, and then spine erect. Any kind of severe lower back, not necessary to extend your spine more than 90-degree position or 40-degree angle. And then, if any knees problem, slightly fold your knees. Okay. Breathe in, raise your both hands up to the vertical position. Lengthen your spine and lengthen your hands first. Now, complete inhalation. Slowly exhale. Along with your exhalation, your body should come down. Along with your hands, not only, do not separate your head and hands. Try to exhale and then bring it together. Look forward, exhale, look forward, and finally reach to hold the toes if possible, or hold whatever possible to you. If you are able to hold the toes, hold it, and then open the soles also. Do not round or keep the halfway open like this. Round yours, open the soles completely, and then bend down. Now shift your awareness to the reproductive organs. This also stimulates the reproductive organs. My uterus is healthy. My ovaries are healthy. Blood circulation is improving to my ovaries and my uterus. Breathe normally there. Hold there for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Breathing in, raise your hands up again. Do not separate the hands and head. Try to bring it together. With exhalation, drop it down. One more time. With inhalation, raise your both hands up, lengthen your spine, lift your chest up, lengthen your hands, straighten your hands. With exhalation, slowly look forward. Along with your exhalation breath, look forward and keep dropping the body down together. And then finally reach to hold the toes. If not possible, whatever possible to you. And then finally head down. Stay there, taking your awareness on the reproductive organs, improving the blood circulation, improving the prana shakti over to the reproductive organs on the fallopian tube, ovaries, uterus. Breathe normally. Hold up to 7 seconds. Breathing in to vertical position. Breathing out, hands down. Now the Ustrasana, camel position. On your knees, stand on your knees. Here again, people who can't hold the heels, you can do a half camel pose. First, we will do half camel pose. Separate your knee distance. The knee distance should be to the shoulder line only, not crossing the shoulder line, and your feet backward. Support your lower back either this way or fingers pointing downward. Now, any kind of spinal injury, whatever you are able to bend, you bend it, else skip this practice. Breathe in, Breathing out, bend back. Stay there. Breathe normally. Breathe in, come up. Hold up to 5 seconds and then come up. Now, those who are flexible, I am able to hold my heels. You can go one by one. Breathe in, breathe out, hold the heels one by one. If not, continue same half camel position. Breathe in one by one, hands up. Then sit on your heels. Now we go lie on the back, turn towards the side, and then go on your back for the next practice in the supine position. So when we lie down on your back, it is called supine position. Fold the legs now at your knees, which is called Setu Bandhasan. That is bridge pose practice. Pull the heels closer to your hip. Hold the ankles if you are able to. If you are not able to hold the ankles, you can keep the palm beside the body, but not necessary to lift your palm when you are in the final position. Your arms should rest on the mat. Now breathe in. Breathing out, raise your body up as much as you can. Bring the chin towards the chest. Stay in this position for 5 seconds. 5 seconds to 7 seconds. Breathe in, breathe out. Now again your awareness will shift on the reproductive organs. Breathing out, down. One more time. Breathe in, lift your body up till the thighs are parallel to floor and chin touching towards the chest, and shifting the awareness on your reproductive organs. Improving the blood circulation. My reproductive organs are healthy. Blood circulation is happening to my uterus and to my ovaries, fallopian tube. My ovaries are healthy. My uterus is healthy. The egg productions are happening properly every month. Exhalation down. Then straighten the legs. Relax your body in Shavasana. Legs apart. Toes flapping to the sides. Hands few inches away from your body. Inner palm facing towards the sky. And your fingers naturally curve. Keep your head and spine in one line. Facial muscles relaxed. Eyes gently closed. Gentle smile on your face. No stiffness in any part of your body. Try to keep your body as loose as possible. Glance your whole body with your internal eyes. Is there any stiffness? If there is, then try to loosen it. Consciously loosen it. Keep your neck muscles relaxed. If it is not resting, bring the chin down so that you can keep your neck relaxed, spine relaxed. Shavasana helps in removing all kind of fatigue, physical body fatigue, and relaxes your mind, which helps in calming down the nervous system. Now slowly take your awareness on your toes. Relax your toes. Relax your feet. Relax your ankle joints. Relax your calf muscles. Relax your knee joints. Relax your thighs, front, back. Slightly tighten your buttocks and then relax. Relax your lower abdominal organs, that is your reproductive organs. Relax your abdominal organs. Relax your lungs, heart muscles in the chest region. Relax your right hand, left hand, from the fingers to the shoulder. Relax your spine from lower back to the neck region. Relax your throat region. Relax your neck. Relax your facial muscles, chin, cheeks, ears, eyes, nose, forehead, top of your head, and relax your back of your head. Now your whole body is relaxed. Now shift your awareness on the breathing. As you inhale, your abdomen is raising up. As you exhale, abdomen is sinking down. This is one round. Inhale slowly. Your abdomen is raising up like a balloon. Exhale slowly. Your abdomen is sinking down. Continue. 5 more rounds. With each inhalation, your abdomen size is increasing. When you inflate a balloon, how the balloon size increases, same way your abdomen size should increase, which means you are working on that lower lobes of the lungs. As you are exhaling, your abdomen is sinking down. Inhaling, your abdomen is moving up. Exhale, abdomen sinking down. Slow exhalation. Continue. This relaxation calms down your nervous system, releasing all kind of tensions, stress, anxiety, which in turn keeps your hormones in balanced state. Once our pituitary gland is disturbed, the hormone productions varies which is responsible for our menstrual cycle, estrogen, progesterone. So this shavasana, few minutes up to 5 minutes, can relax your entire body. Just say to yourself, I am relaxed. My whole body is in a relaxed state. Now slowly take your awareness outside. Move your toes, move your fingers, move your head to the sides, to the left and to the right. Bring your legs together, hands together, and then raise your right hand up next to the ear. Fold your left leg, turn towards your right side. Unfold your left leg on your right leg, left palm in front of the chest. Feel the entire weight on your right side of your body. And then, with the support of the left palm, come to the sitting position. Sit in any comfortable position. We will go for one pranayam practice, which helps in calming down the nervous system, which helps in your stress, balancing the stress, anxiety, depression, all those things will be taken care by this practice. Sit straight, Nadi Shuddhi Pranaya, Anulom Vilom. Left hand, Chin Mudra, thumb tip touching the second finger. Rest it on your left knee. Right hand, Nasika Mudra. Right and third finger, second and third finger is close towards the palm. Thumb and ring finger is used alternatively to close and open. Now sit erect, keep your eyes closed. Gently close your right side with your thumb. Inhale slowly from your left. Close your left with your ring finger and then open the right side and exhale. Inhale again from the right. Close your right with your thumb gently and slow exhalation from your left. This is one round. Again, second round. Breathe in from left. Close your left. Breathe out through the right. Again, slow inhalation. Slow inhalation to fill your lungs. Close your right and breathe out from left. This is second round. Continue. 5 more rounds. Try to inhale longer. And exhale longer. Nadi Shuddhi helps in cleansing the energy channels, removing all the blockages, improving the prana shakti, that is the vital force, to move freely on the energy channels. Each inhalation, try to make it deeper and deeper. Long inhalation. You should find the difference from the fourth round, fifth round. Your inhalation is becoming little more deepening. And then with exhalation, not exhaling in one go, try doing it slowly. If you're not able to exhale slowly, you can even count reverse number, say like from 4 to 1. When you are exhaling 4, 3, 2, 1, count this mentally. This will help you to exhale slowly. Once you have completed the rounds, drop your right hand back on your knee. Remain still in the same state without opening the eyes, trying to feel the state what you are at this point of time, experiencing the calmness in your mind. Your breathing is rhythmic, heart rate is rhythmic. Now, let us conclude the session with 3 Omkara and Asatoma prayer. Take a deep breath in. Breathe in. Breathe in. Join the palms in front of your chest. Asato ma sadgamaya tamaso ma jyotirgamaya mrityorma amritam gamaya. Om Shanti Shanti Shanti. Palming again. Rub your both palms gently. Then make cup shape. Keep it on your closed eyes. Thank you. If there is any questions, we can take the questions. As the next program has been scheduled, so we will be meeting it tomorrow. Thank you. So all the questions will be answered tomorrow also, and a few more practices will be added along with the existing practices. Thank you very much.
So he will take us through the... Namaste, doctor.
Yeah, namaste.
Yeah, so Dr. Nitin Kumar has done his basic qualification as BAMS, and later he has gone on to do his PhD in yoga. And right now he is affiliated with MAHE as an associate professor in yoga and Ayurveda. He has over 16 years of experience, and his area of interest is on integrative medicine. And he has several achievements to his record. So he is a research associate and has founded, guided a lot of PhD students. He has also done a research and drug trial in collaboration with the research in Germany. Then he's also visited different countries as a research scholar and teaching faculty, visited Singapore, Germany, to name a few countries. And he also has several research publications to his credits, 20 publications with journals in India and abroad also, and 3 chapters in a book of geriatric medicine, Ayurveda and yoga. So welcome, Dr. Nitin. So over to you, so that you can enlighten us on the Ayurveda and yoga component for the... Dr. Nitin.
Hello.
Yeah, welcome.
It is reflecting I am in a backstage. Is it okay? I am. Hope you are able to
No,
hear
no,
me.
it is... Yeah, yeah.
Yeah. Okay. So I have 15 to 20 minutes time to share my thoughts on. So I will just share the slides. I'm first time using this your pattern, so I'm just It is saying size limit is only 50 MB. So let me share my screen. Okay. Hope my slides are visible now. Hello.
No, doctor, it is not able to see the slides. Yeah, I think it's loading. Yes. Yeah, now we are able to.
Okay. Thank you. So hope my slides are visible now. Okay.
Yes.
I'm sharing full screen because I'm not able to load it. It is more than 50 MB. It is limited to 50 MB. Yeah. Hope it is now visible now.
Yes.
Yeah. Thank you. So welcome all you for this yoga and menopause. So thank you, madam, for the brief introduction about my CVs. So usually we start any of the yoga session with the prayer. I will skip it because of the lack of time. I bring greeting from Mahe, so one of the premier institute. So we will try to understand what is yoga and what is menopause and what are the practices and what are the research evidences overall. So yoga basically one of the Shat Darshana you all know. Ancient Indian science is having a very huge base of knowledge. So among them, you can able to see here is the darshanas. So there are called Shat Darshana. Among yoga is one of the Shat Darshana. So yoga is basically a philosophy, but nowadays we are trying to use yoga as a therapy. What made think yoga as a therapy is a major understanding, because it is not doing some body movement or doing some small breathing exercises which helps. Understanding the principles and incorporating the practices in life makes a difference. It is not only practices which helps. In addition to the practices of yoga, we have to understand the principles of yoga and incorporate for any diseases. So yoga is also not different from them. So yoga is not only limited to the physical body movements, or it is not a kind of gymnastic. So I am old, because menopause is a disease of old age people. People will be having a lot of associated conditions, maybe diabetes, some cardiac elements, or some rheumatoid, some osteoarthritis, in addition to the menopause. So people should not, limit themselves, because giving an excuses, or maybe having a wrong notion that they can't do it because they have some problems. So yoga is much beyond that. So basically, if we understand the definitions of yoga, it's a mind management. It's an exercise for the mind. So if you go through the definition of Patanjali, definitions of the Vasistha, or a definition from the even our Arabindo, or maybe any of the new recent yoga masters, they are all focusing on the mind aspect rather than the body. We use body as a tool, we use the breath as a tool, we use mind itself as a tool to control the mind. So that's what I would like to bring a important component here. So yoga now becoming so popular, especially after the International Day of Yoga. A lot of schools are there across the world. So when I was there in Singapore in 2008, so I was able to witness more than 63 types of yoga in Singapore itself. So it was shocking for me. So I tried to compel the yoga. So what I found out is yoga, people are made a permutation and combination, and they given their own names. So there is hot yoga, hatha yoga, pure yoga, true yoga, Pattabijesh yoga, Sri Sri yoga, Patanjali yoga, Baba Ramdev yoga. So there are a lot of things. No, and there is n number of list. No, we can keep saying. So what I'm trying to bring you to the conclusion here, for in concern with the different schools of yoga, Swami Vivekananda divided yoga into the four streams. Actually, yoga is basically one which a tool which handles the mind. So why I'm talking menopause and the mind, because menopause is a phase where woman goes with a lot of turmoil within the body and also in the mind, and this is the physiological change, and sometimes which requires an attention or no intervention. So understanding this concept is more important, then only it will help. It is not the body movement or some postures or some breathing exercises makes a difference. So, as I said, Swami Vivekananda divided yoga into four streams: Karma Yoga, Jnana Yoga, Bhakti Yoga, and Raja Yoga. Maybe so few people can, in the age of menopause, few people can take a path of bhakti that also will help them to tame or have a better transition of this phase, physiological phase called menopause. Okay, so some people can, if the intellectual people can address with understanding the menopause and the psychological aspect, that can be called as the Jnana Yoga. Few people can do a started social servicing, because the ultimate goal of everybody's life is dharma, artha, kama, and moksha. If you do a selfless servicing at the age of at least why God has given this menarche, menopause, there is a fertile time in between. So it's a nature's law to make us understand we are starting a new chapter of a life. At least then only we will at least recognize, or maybe rewind our life, or revive our life as a whole, and try to uh, come to the track if we miss the path of the ultimate goal of a life. So that's what menopause is one thing, where the karma yoga is also plays a very important role. And you all know Raja Yoga is very famous. It is famously called as Ashtanga Yoga. So everybody may be more interested to know what are the asana to practice, what are the pranayama can be practiced, and what kind of meditation I need to do to have a smoother phase of so-called menopause. So definitely I'm going to give few of the asanas, few of the pranayamas, few of the relaxation technique, or maybe a meditation or yoga nidra. But understanding the concept of yoga nidra or maybe a yoga components of yoga pranayama is more important than simply practicing that, and also what's its link with the menopause is also very important. We try to understand. So what exactly everybody want to know how a practical yoga sessions need to be started. So yoga need to be started with a brief, warm up exercises before entering in. A lot of people complain that they start doing Surya Namaskara or some advanced postures and end up with some pains, and they say practicing yoga will causes some amount of pain. So it is, if you practice, you don't end up with any problem. If you problem with improper practicing or without a warm up you will do it, that's a problem. Then usually warm up exercise will be followed by the asanas, pranayamas, and ideally it will end up with some kind of meditation or dharana or dhyana based on the requirement. So there are different sets of practices which we try to understand as a whole. There are sitting, standing, supine, and prone, and also some amount of the pranayama, which is told is the free of cost available from the uh, MD, Morarji Desai Institute of Yogic Sciences. So we can categorize yoga also into relaxative, meditative, cultural. So now try to understand the principles behind these practices, then we will able to understand the practices much well. So pranayama is not the practices of the breath or practices for the lung. Practicing pranayama brings a neurotransmitter or maybe a biochemical changes or maybe autonomic nervous system changes within the system, which will able to help the menopause, because where the hormonal therapy is also advised if it is required. So we need to understand it as a whole, not as a breathing exercises, because it is much beyond that. There is a pranic related issues, especially the apana prana and the Vyana prana. So we need to understand this as a whole, then only we will be able to understand the fine. So what exactly pranayama does, it brings the turmoil mind into the quiet mind like a lake. A turmoil falls, the mind is turmoil in the face because of the physiological changes. Okay, so that can be brought. This changes happens at the neurotransmitter level, this changes happen at the biochemical level, this changes happens at the neurophysiological level. Then that's how the pranayama works. It's not by doing the breathing exercise for the lung. It is basically an exercise for the mind, especially the bringing the and in addition to that, you may be knowing the different types of relaxation techniques can be practiced by the different kind of people. That's more important. If you understand the different relaxation technique, we can able to choose, because a lot of people do a dharana and they say they are doing meditation. A lot of do a concentration. If people feel they are doing something, it is not called meditation. Meditation is a stage where people will reach a stage there where they will not feel they are doing anything. That's called the meditation. Single object, single thought with effort is dharana. Single object, single thought without effort is dhyana. Usually a lot of people do a lot of effort to maybe focus on the center point of the eyebrows, or maybe on the nose, or somewhere maybe visualize something. There is an effort. If there is an effort, it is called dharana. If there is no effort and people will be able to remain with single thought, single object for a longer time, that is called dhyana. So who can practice yoga? Anybody can practice yoga, even anybody. It's also applicable for the people with a serious injuries or serious diseases, maybe a geriatric population, and also menopause. Ideally, yoga therapy consists of the asanas and also some of the cleansing technique, and understanding the resonance, and also understanding the counseling is also very important phase of which I would like to emphasize here, as I already emphasized about the asana and pranayama and meditation. Here I would like to emphasize about the counseling, because this is a phase where a lot of hormonal changes, irritation. I will come to the menopause part very shortly. So where they require a lot of CBT, and this counseling has to be done maybe with the Eastern approach, taking the help of Bhagavad Gita, the purpose of life, why we are doing Sattvic, Rajasic, and Tamasic. So before entering into the menopause application, what usually we do for the yoga therapy for the menopause in our institute here is, patient will come to the OPD, they will be seen by the OBG consultant if it is required, because it's a natural process. So then they will be taken history. Based on that, they will be personalized. Integrated yoga therapy model will be designed by the yoga consultant, and later it will be followed by yoga therapy consultant will usually provide. So these are all the setup practices which I have already told you, including diet, some cleansing, pranayamas, and also the counseling, including understanding the philosophical component is also important. So to sum up, my yogic part of the today's talk is both principles and practices of yoga is important. It's not only the practices of yoga if you want to get a optimum effect or positive effect of the yoga. So 21st century life really brought us lot of change within us, and it's also affected the whole generation, and a lot of people at the menopause. Lot of people are staying alone because their kids are settled abroad and there are nobody to take care of them. It's a phase now. Usually start at 45. Nowadays it is now seen little earlier because of the wear and tear. And the lifestyle modification happens in the diet pattern, exercise, because nowadays menopause women are also practicing, maybe working somewhere. They have a more challenges, compared to others. So the media gadgets, what we are able to see, it's also affecting the menopausal woman because she is maybe watching the serials, or maybe watching the social medias. People are only wishing through that, and that's also having a lot of effect on the menopausal woman. So stress is something which is there for everyone, including a menopausal woman. So that need to be tamed much better here. So stress, as per the understanding of the yoga, is the when there is a uncontrolled thoughts. People, this may be happen in menopause due to a hormonal, and also there is some amount of psychological disturbances, and also there is a imbalance in the sympathovagal tone. So, what exactly menopause is all about? Menopause is something where the more than 12 months of the amenorrhea, and there is usually it doesn't require any test. Usually in routine, these are all the few criteria as per the Indian Menopause Society, which I'm not going in detail. So, what I'm trying to make you understand, menopause is not a disease. It's a physiological phase of any woman which doesn't require usually any test. No, it can be diagnosed in a routine based on the whatever the few of the I have given. There are different stages in the menopause, which is called perimenopause, premenopause, perimenopause, and postmenopause. So we have to prevent. We can treat sometime a palliative care in the stage 3. In stage 1, we can able to prevent certain premenopausal symptoms by giving some simple techniques, which I will give. I have already briefed you. In stage 2, already the symptoms have been started. People are in the menopause phase, where we can able to see the stage 1A. It's 1 year after the period, last period. uh, in stage B, up to 1 to 5 years period will be called as a menopause. That's called intermediate, or mostly postmenopausal symptoms has been seen. Where we will be able to observe in the second stage B, we will be able to observe more hormonal variation in the psychosomatic, including genital changes, sexual lack of sexual desire. All these things has been seen. There is a lot of turmoil where we need a very vigorous intervention here, yogic intervention. What I'm trying to talk about. In certain cases, we can also give the hormonal replacement, hormonal therapy. Stage 3, where we will be able to, after 5 years of postmenopausal, till that complication, or sometime they required a palliative kind of care. So that also will be associated with like osteoporosis, Alzheimer's, where the dementia maybe sometime associated. They require a palliative care kind of treatment. So, so when to call it? It's a very pre-menopause, perimenopause, and post-menopause. This slide summarizes everything. When is a premenopausal? Less than 3 months ago, a regular bleeding happened. That is called premenopausal. Less than 12 months of ago, irregular bleeding, menopause. Then that was, and sometimes a surgical removal of the ovaries also can lead to menopause. So these are all the different stages where how to give intervention, what are the things which has been already briefed. So these are all the common symptoms. If you see the hot flushes, night sweats, or maybe a weight gain. So yoga helps in controlling the hot flushes, night sweats, and also weight gain also can be reduced by regular practice of yoga. and because it brings a hormonal balance and also certain psychological disturbances, mood changes, including the sleep. So if you go to the modern, they will be treating the symptoms in a very different manner in addition to the hormonal therapy. But yoga is a one point solution. It can address the sleep, it can address the mood swing, it can address the weight gain, also in certain other Alzheimer's and maybe other complicated related in certain cases. So yoga is a one point solution. It's a holistic approach, can address multiple approach. So in last 2 minutes, I would like to make you understand what menopause women show the her signs and symptom, or maybe the expresses or emotions are the tip of the iceberg. Most of the, so there is a need to sit with a menopausal or maybe at this transition period, and where people need to support her because there's a physiological changes because of the lot of changes of the hormone and other there. So the emotions what they show outside is only a tip of the iceberg. There are a lot of turmoil within the menopausal women need to be addressed when we do an interaction during the notional correction, or maybe counseling session. We may be need to understand this. So to sum up and summarize, there are a lot of research has been done in this area, because yoga is one of the complementary and alternative medicine. In a similar manner, there are 704 articles has been found. Not only yoga, it is all together complementary and alternative medicine. So yoga is one of the complementary and alternative medicine which is widely used for the improvement of the psychological well-being compared to others. This is one of the systematic review or meta-analysis which found yoga can be used as a one of the important therapeutic or complementary tool in addressing the signs and symptoms of the menopause. So it can be more effective compared to the exercise. So this is another study about the quality of life in post-menopausal women, which is found yoga improves the quality of life in menopausal women. There is no, and it is very cost effective that has been provided. So to sum up and summarize, yoga is one of the important tool for the menopause. It addresses menopause as a whole. It addresses the mood disturbance, anxiety, depression, stress, hot flushes, back pain, somatic, cognitive function, Alzheimer's, sleep disturbances, cardiovascular, and even including urogenital. So how yoga works? Yoga works through the HP axis. It brings the balance in the neurotransmitters, reduces the cortisol, reduces the sympathetic, and it enhances the parasympathetic. That's how it helps. So there are a lot of evidence to say that yoga helps in the stress management. So simple breathing exercises can be advisable, especially sectional breathing, which helps in the menopause. Nadi Shuddhi is very, very important, which will again bring the balance at the neurotransmitter, including the hormonal. This is the practice. Another very specific pranayamas are all Sitali, Shitakari, and Sadanta. These are all called cooling pranayamas. Maybe my colleague, Malati will take about these practicals, which I'm not going to discuss much. They're all the cooling pranayama, because there is hot flushes and other pitta related symptoms will be there, can be addressed, including the Brahmari, which will give a sound soothing 3D kind of awareness can be given, and it will help you to calm the mind. So Kriya is also very helpful, not directly, indirectly. Like not only this is Neti, overall all other, including Trataka, which is can help in calming the mind rather than the cleansing the this thing. There are all the few practices which will be taught by Malati after this class, this thing. So this is what because I was been assigned around 20 minutes, so I am almost done my slides. So we need to make a menopausal woman understand about the philosophy of yoga, because it's a transition period. Chaturtha Purushartha Sadhana is the goal of a life. So we need to understand the nature as a whole, because how menarche starts, it is not usually cycle start in the beginning of the when birth has taken. It starts at a certain age, and there will be a productive age, and it will be stopped. That's how the God has designed this life is all about. It's an important phase of a life to revive, revise, and reconsider our path, and to move towards the ultimate goal of a life. So understanding the philosophy of yoga is more important for the woman. So usually she faces a lot of challenges. This is I have adopted from Gaur Gopal Das, one of the talk. When people complain a lot of problems in life, this can be addressed. When there is a problem, you should not be worried, because uh, when you have a solution for that, you just address it. If there is a problem you can't solve it, then also you should not worry it. He gives a very nice narration about this picture. So this concept needs to be made understood by the menopausal woman, so that she can able to understand. So you can just explore few of these practices through the common yoga protocol in 5 minutes. This thing. So we need to address ahara, vihara, achara, vichara of women, which can be addressed holistically. To sum up and summarize, yoga is a way of life. It's a need of our for a woman with a menopause. It enhances the quality of a life. Okay, so integrated yoga model will address the physical fitness. This is more important for a woman who is in a menopause phase. It will bring the calmness by psychological well-being, and social well-being also it will bring, because she will be finding difficulty to adjust socially. The important component what I really want to emphasize here is the spiritual orientation also through the yoga can be incorporated. At present, there are very limited studies. So there may be a multicentric with a robot design with a larger sample size or need of our to see its efficacy at a molecular or maybe some underlying mechanism of how yoga works need to be explored. If anybody have any questions, they can ask. I am almost done with my slides. Thank you. सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्. ओम शांति शांति शांति. Thank you so much.
Yeah, thank you, Doctor, for a wonderful session and enlightening us on how yoga can help in menopause. And I'm sure Mrs. Malti will again, in her session tomorrow, take up some of the practices that you had mentioned. So thank you.
Thank you. Thank you, Vijay madam.
And thank you all the participants for joining the session. Hope to see you all tomorrow again at 11 a.m. Thank you.
Thank you.